All right, so we're going to get started. Welcome to my very first master class on contract clarity. Um, so I'm Jacqueline. I'm a nurse practitioner. I practice in primary care, and internal medicine is like my background as I've basically journeyed through being a nurse practitioner. I have a background prior to that as a registered nurse in critical care area. Was in critical care for like 15 years and then transitioned into, achieving my FNP. Let me switch screens here. So a little just about me, I kind of wrote in here. I graduated from Lewis University. I am a full practice authority, advanced practice registered nurse in the state of Illinois. I've also previously taught nursing to BSN students. I was an assistant professor of nursing, and I taught advanced med surg nursing, where we focused, on the critical care piece, and then also capstone and professional development for those students. I also recently have created a wonderful company because teaching people really is my passion, and helping to really elevate nursing as a whole profession is really my passion. So I've created Nurse Education and Empowerment this past year. And today is my very first online teaching in this group. So I'm so excited to be here with you. I don't have any kind of potential conflict of interest. I did not get paid. There's no funding or sponsorship. There's no disclosure that needs to be made. Um, you know, uh, we're not even talking about products here. Kind of the biggest thing in this slide is the disclaimer. I am not a contract lawyer. I am a nurse practitioner. My strong recommendation is that you always have an employment contract reviewed by a lawyer for making sure that the legal language is appropriate, and for advisement. Kind of jumping right in, um, the biggest thing that we've always, or at least my thinking when I was becoming an NP, was always really about like the compensation. Like that was a huge thing, and it is a huge thing. But when you transition to being an NP, there's kind of this whole other world. I know that I did not feel prepared. I didn't really have any strong mentorship behind me, with another nurse practitioner kind of guiding me about the things I'm going to really talk through today with you. I really wish I had somebody, but there is a lot more than compensation that actually matters in a contract. I'm actually going to try to switch my share screen, and I do have links that probably will populate after this. Let's see. Can I change my screen? Okay, I cannot change between screens on Facebook Live. See, that's a good learning curve. I included links. Anyways, there is this medical group. It's called the Medical Group Management Association, or MGMA. There is free and paid versions. My recommendation is to really actually open this as a nurse practitioner to understand national benchmarks for compensation models. Like it's a good understanding of like what the averages are. Um, Basically, how is your compensation designed? When you get an offer, you should take a step back and say, is what I'm being paid fair for my state, for my area, for my area of practice? Um, what am I, as the nurse practitioner, bringing in revenue wise on averages to these types of practices? So this particular site really does a good job at kind of laying the land and helping you to know if you're being paid fairly. There, like I said, there's a free and a paid version. The good things are unfortunately in the paid version. There's also a free site that takes data from MGMA about compensation models, that is free. If you basically put your information about what your compensation is in, so they're basically gathering data, but you can see, by your state, by practice type, what averages are in your areas. It also like provides insight of like, okay, for this amount of compensation, This is what the call schedule is. This is how much PTO people typically get, just so you can see if this is fair for you. Most practices standard have, volume expectations. Some practices that I have, either worked for or have talked through with other nurse practitioners have like actually volume expectations where they want you to see a set number of patients. Some have where it's called an RVU structure. Some just strictly use RVU structures. That is a whole presentation in itself. But an RVU in short is basically a metric that's used by like both Medicare and private insurers in the United States that tries to quantify the cost of like medical services. So it basically takes into account um, how much productivity for your area, basically how much like, technical skill, time that you're spending for a patient with a certain diagnosis, how much mental effort and stress is involved with like decision making based off of their comorbidities. So it's a very complex structure, and it also kind of takes into account like what the average practice expense would be, like an internal medicine practice versus, I don't know, a cardiology practice might have very different practice expense. And that's practice meaning like the place that you are employed by, like how much it costs, for the overhead, staff salaries, equipment, that sort of thing. So it's like this whole conversion. But some pay models are based off of RVU, structures. Some even include like RVU bonuses or patient volume bonuses into their payment model. I've actually worked, me personally, two different ways. I've worked in a model where I've had like volume expectations. Like, for example, I had a place where it was like a set volume over 20 patients a day. I got, a bonus per patient seen above and beyond that. Same thing with like RVU. I've had where you meet certain amount of RVUs per month. It's like a set metric, and then anything above and beyond, you get paid per RVU. In doing it both ways, you 100% make more, just from personal experience, with an RVU bonus structure. 100%, hands down, like significantly more. Plus, you are not necessarily like, you know, kind of chasing a carrot, I feel like, with trying to get certain patient volumes, uh, you know, at all times. Compensation models also should take into account like malpractice. We're going to talk about that on another slide, as well as like there should be language in your contract about tail coverage responsibility. And then a lot of roles do have sign-on bonuses, or if they're asking you to relocate, like relocation, like money set aside for you that, kind of overall is part of your package. Back to that medical group management association, it is saying that it is becoming pretty much a standard practice that nurse practitioners are receiving bonuses. That used to be just, I guess, really focused on like physicians, but bonus structures are becoming more and more commonplace for nurse practitioners. With my in my current role, like that was a part of my package, and it's also like allowing the company to have retention for employees too, because a lot of sign-in bonuses maybe have clauses like you might have to pay it back if you don't work there for a year or 2 years or whatever their terms are for that bonus, for not payback. A lot of jobs, it's commonplace to have be on call. Some include that as part of your compensation, some don't. Your pay really should justify that accordingly, I feel like. We'll talk a little bit more about that in a few minutes. And then, compensation should include, your contract should include like language about like, licensing. I know a lot of nurse practitioners that they have to pay for their licensing and their DEA. And just to kind of put it in a perspective, like that's going to add up. It's like $888 every 3 years for a DEA license. And then we all take national certifications. So dependent on which national certification you take, there's costs with that. So for non-member, for ANCC membership, for non-member, to renew your license, it's $375 every 5 years. American Academy of NP certification is like $195 for non-members. So these things add up. Also, language should be in your contract with regards to if they're going to pay for any continuing education courses. I mean, average CE course is $15 to $25 per CE. And for like, I'm ANCC certified, I need 75 contact hours per year. I'm sorry, not per year. That'd be a lot. Every 5 years. The state of Illinois, that's where I practice. That's also then, it's like a separate thing, 80 hours every 2 years. So you can kind of just see how at $15 to $25 a pop, those continuing education hours really do add up. Another thing to think about is conferences. Like, are you going to get time off for, allowing you to have the release for conferences, or do you got to eat into your vacation time, and so forth. We talked about these two resources. So, reflection question: if your salary increased, you got like this great deal on paper, but your workload was just astronomical, your workload's doubling, would that to you feel like success? In my opinion, money without boundaries is going to equate to burnout. Workload and scheduling. Like I said, a lot of places do have expectations in terms of volume. I think that it's very different depending on how seasoned as a nurse practitioner you are, of like what is considered to be a good amount of volume. I can't answer that. It's very different for each area that you'd work in. Internal medicine, where I have background in, for example, you're taking care of multiple people with very complex needs, multiple systems involved. They're diabetic, they have hypertension that's uncontrolled, they just had a stroke last month, they're on blood thinners for AFib, their big toe hurts during the visit. Like, there's just like lots of things. So to cover all of those things adequately, it does take time. Other places like urgent care setting, for example, you're just seeing, maybe somebody that has strep throat. Like, it's one system, my throat hurts, we swab you, oh, now you have strep, and we give you an antibiotic, do maybe a little bit of teaching and send you on your way. It's very different of like what length of time you actually need in each setting. But I think having explicit language about what the expectation from the practice is, plus how much time you're going to be given per visit, is actually a very important thing. You don't want to start at a place and you're told one thing verbally, and then the next thing you're turning around and every single slot for you is in essence double booked. Where, on paper you should have maybe 20-minute time slots, and now you only have 10 minutes with these patients. It's something to definitely consider having written in a contract language. Making sure that there's actually administrative charting time built in. This across the board is pretty standard that you would have actual time built in. Like, so if you're a 40-hour work week, depending again how much resulting that you need to be doing, some places that I've heard of give literally an entire maybe day where you have the entire 8 hours to do stuff. Other places maybe have 2 to 4 hours. So it's just depending on how much you are going to have to be resulting, which you are going to have results basically in any practice you do. Making sure you have time built in, like where you're just not stacked up on patients back to back to back every single moment of your day. There should be a structure in place for weekend, and then just conversations about like holiday expectations. Does your office operate on the holidays? What holidays do they operate on? Are you given time off if you are expected to work those holidays? Like, are you given like an additional week of vacation or whatever? Like, just what's important to you. I mean, some people don't mind working holidays. Do you get paid more on holidays, or are you just straight salary where they're expecting you to show up on Christmas or whatever holiday is important to you and you don't get anything extra? Um, so I think that's an important question to definitely ask and just reflect if that is important to you. Call coverage, having very strict language about your call coverage in your contract is a must. You need to protect your energy. Are you on call all the time for your practice? Is that call going to your personal cell phone? Do they use a HIPAA compliant software that they are paying for your call coverage? These are all like yes or no things that you need to think through. Um, I got really burnt out because of the amount of call that I was expected to take. Basically, I had rounded at skilled facilities and everyone had my phone number. And I mean, I was on vacation on a day that I had off, scheduled off, given written notice about. And actually, this particular day, I didn't even work regardless, even if I wasn't on vacation. I got 43 phone calls. Can't even make that up. Turn my phone off. But it's like, what is the call expectation? Like, um, definitely very important to consider that. Most places do have a call expectation. You just have to decide, is it reasonable or unreasonable for your lifestyle, meeting your needs of you and your family, and then just having explicit language. So if they're telling you that your call coverage is 8 to 5 these days, but then it's changed, like per them, you need to have this very explicitly written, okay? That's just to protect yourself. Collaborating physician requirements. Many states have, you know, legality around having a collaborating physician. Does your employer pay for the collaborating physician? Are you working for, a practice with a physician in it that they're able to pair you with somebody and they're covering those costs? If that's important to ask. Like, if no, the average cost that you would maybe have to hire your own collaborating physician is anywhere from $700 to $900 a month. In some states, I was even looking up data, like Georgia, for example, is $1,161 per month to have a collaborating physician. Now, this does cover the legal chart reviews that they're doing and maybe consultations where you can call them at any time, and maybe even their malpractice. So that's why there is costs with that. But a lot of places I know of do give you a collaborating physician if you're working in a practice. But this is something that I would also recommend to really explicitly ask about, so there's no surprises once you sign that line. Reflection for you in the practice that you're looking to transition to. How many patients per day allow you to practice safely? What visit length would help you to provide quality care? And how much charting time do you realistically need? If you're just starting off as a new nurse practitioner, these questions are a little bit hard to even like come up with answers for, and like what is good. I would recommend definitely, like, when you are considering a role, asking for a job shadow. If they have like a nurse practitioner in that practice, that would be ideal to shadow them and really kind of ask these types of questions. It'll give you kind of clarity. Or even asking, like joining an association where you have collaborative support with nurse practitioners in different care areas that you can maybe, in a safe space, like reach out and ask these types of questions. And just making sure that those questions, whatever those answers may be, is reflected in your current or proposed contract. Liability and legal protection, malpractice coverage. I am not, like, again, a lawyer, but just some of the things I've learned about malpractice I want to share in just some languages. I have a couple slides about malpractice coming up, so I'm just going to hold on that. And I did touch on already, like, the collaborating language around having a collaborating provider. I think I have it in here. But one thing I want to say with that is a lot of states do have full practice authority, okay, where you don't need a collaborator anymore. Um, I actually have a colleague of mine who recently reached out, because I am full practice authority, just to ask what the process looked like for that. Um, they're, the person that they're collaborating with does not want to sign off on their like form that they've met all of the hours and the criteria for full practice authority in with the rationale is basically they don't want to lose them as an employee because this person wants to start their own practice and they basically want to cut in on that. Having language in your contract that if you are eligible to have full practice authority, that basically would state something like that once you meet these criterias, that your practice would support you becoming full practice authority to be practicing at your full scope of your licensure is very important in my opinion. You don't want anyone controlling like your license that you worked for by kind of playing games and not wanting to sign. There are clauses oftentimes in contracts, like it's called an indemnification clause, where it's like basically saying who has liability to cover legal costs and damages if like a lawsuit were to happen about liability for negligence. A lot of clauses are one-sided, which they favor the employer, which makes the NP then liable and responsible for damages, even if there was a problem with an employer. I have not been sued, thankfully, and praise God, but situation that, one of the reasons I left a practice is I didn't feel safe with how they were operating, resulting. And there seemed to be no improvement. If anything, it was just actually getting like more and more downhill. And this made me uncomfortable because I'm ordering tests because I think something is wrong with a patient and I'm ruling and working people up appropriately. And, I'm resulting, hey, this person has abnormal CAT scan, call the patient in. And if the way that the practice is structured, they don't have the appropriate staffing to, within a reasonable time frame, call and schedule appointments and bring these people in. This is kind of like the situation that this clause could be impactful in. So just another thing that brings me to is just making sure whatever job you do choose to say yes to, like what kind of support staff do you have? Like what are the processes for these things? These are very important things to think about, and actually it will again protect your energy and protect you from burnout. Okay, malpractice insurance. So there's a couple different types. Occurrence based. This is the one that you want because not all policies are equal. That's my little tagline up there. So malpractice coverage is not just a benefit, it protects your license, finances, and your future. So occurrence based malpractice coverage, you're covered for any incident that occurred while the policy was active. So if you worked in 2024, patient sues in 2027, and you have this type of coverage model, you are covered. Like that is okay. Like you are still under that policy. There's no TAL coverage needed, which is like needed if you have different types of insurance after you leave a job. So this gives you peace of mind. It also gives you like a cleaner exit. It is usually more expensive for the employer. It's pretty much average, like standard, I'm sorry, that an employer would actually be paying for your type of malpractice insurance. It is important to know what type of malpractice your employer is offering. So for occurrence base for APPRN is about $2,000 to $2,200 annually. Okay, so for peace of mind, if your employer does not provide this or they're not willing to provide this for you, my recommendation is get your own policy. I mean, it's just put the money aside for that, or maybe negotiate, for a sign-on bonus to be able to cover the cost of like having that kind of, policy, just for peace of mind. There's also claims made coverage. So your only coverage if the lawsuit or incident's happening while the policy is active. So if you leave a job and you have a claims made coverage policy, you need TAL coverage. TAL coverage is very, very, very costly. It's very important that if one of the ways, an employer or recruiter is drawing you in and they're telling you, hey, we pay for the TAL coverage, which can be, like $5,000 to $15,000, depending on what kind of practice you're in, that you would pay to the insurance provider. So sorry. to make sure that you have coverage with the claims made, which is, good chunk of change. Like if the employer is telling you, hey, that they pay for it, that needs to be in your contract, okay? Like non-negotiable, needs to be in your contract to protect yourself. I had a friend who was verbally told that their tail was included, and when they left their position, that employer, you know, wouldn't pay for it. They had to cough up a couple $1,000s in a job transition. So tail coverage, yeah, it's usually between 150 to 200% of an annual premium. I'm sorry, I even misspoke. So 5 to 20,000, depending on specialty. I thought I'd read 15. But yeah, good critical question to ask is who pays for this tail? Is it the employer? Is it shared like 50-50? Is this you? This has to be in writing. It really can wipe out, a lot of money. Verbal promises mean nothing. Absolutely nothing if they're not in writing with anything. Okay, so just picking of really what's important to you and making sure that's explicitly written. One thing I wanted to even say, kind of touching on this, if you have verbal agreements, even when you're talking with an employer, they might have start off with good intentions. I'm not saying that people have maybe malice in this, but if they tell you, hey, we expect you to be in clinic, there's no punching in, no punching out for this amount of time. Yes, you could be off at 3 o'clock on these days because we want to work with you. We believe work-life balance. You have childcare needs. And then you're a month in, and then they're like, no, you must stay until 6 p.m. every night or 7 p.m. every night. And you don't have that in writing, you have nothing to stand on. It's just like a handshake. So make sure you have that. That's important to you, and that's part of the reason you're taking a job that has to be in writing. Your exit strategy. Do you have a contract that is a certain length of time? Like, does your contract say basically that you must be there for a year, 2 years, 5 years? Or are you at will where you can give notice at any time? Do you have termination clauses? Can they terminate you at any time? Is there a certain notice period? Like, do you have to give a very large amount of notice? That's really important to know. I've worked with an employer before, and I don't know necessarily that there's like a standard or averages. Oftentimes it's not like a job that you've had before where you give a 2 weeks notice. Like usually there's a longer notice period, and that could be anywhere from a month, 3 months, 6 months. So you have to really reflect like what's reasonable for you. I worked in a place before that had a 3-month notice, and that's really hard, like especially if you're leaving a place. Maybe you have a new opportunity that opened up. Is that opportunity going to wait for you for 3 months? Are you unhappy and that's why you're leaving? Are you going to survive, like from a mental standpoint, that 3 to 6 months? So it's important to like think about, do you have to have contract renewed? Does your contract have like, an end date? Where you're literally just signing something like, yeah, I work here for a year and that's it. Or is it renew automatically? Is there a process in place? And that's a good interview question. Like, what is the performance review schedule? Because this is where you want to have a sit down with your employer, at least annually, if not more, where you're talking about, hey, what can I do better? These are things I see that I think the practice could do better. And then you're like negotiating, like, I've really ramped up the amount of patients I've been seeing. I know I'm bringing the practice a lot more revenue. I have the expectation that I'm going to have a cost of living raise plus this, and you can renegotiate things. Like, how often does that happen? So, good reflection point I want to ask you. If you needed to leave your job tomorrow for your mental health, how hard would that be with your current contract? Clarity reduces fear. Restrictive clauses. So kind of a hidden trap, right? I've seen a lot of banter on Facebook groups and so forth about non-competes, or where you don't have like an ability to work in a certain field that you're signing, basically to not take business from that employer, that some of them are not holding up. I don't know how true that is. That would definitely be a legal question. But making sure that if you have a non-compete in your contract, how long is it? Is it 6 months? Is it a year? Is it 5 years? And then, like, what is the radius? Is that 1 mile, 2 miles, 50 miles? You know, one way that the contract lawyer that I had hired, talked me through when I was, like, for example, in an internal medicine practice, they wanted a non-compete clause in there. Instead of saying, okay, you can't work within a 5 mile radius for a year of the practice as a nurse practitioner, just like leaving that very open-ended, being very specific. So changing that language to say you cannot work as an internal medicine NP, or for maybe in cardiology, can't work as a cardiology NP with, 5 mile radius for a year. This gives you more opportunity. So if you wanted to work in a pulmonary office down the street, or a pediatric office, or something different that you're not directly competing and going to be taking business, it gives you a little bit more like flexibility, while also, like, I think it's a good negotiating point and happy medium for the employer to have a non-compete, but making it like less compete-y. Some places do have in their contracts that you're not allowed to work for other places. A lot of nurse practitioners I know do take on an additional, like, job or side hustle, as you'd call it. Some contracts are very restrictive on that. So just knowing if that's something that you're interested in doing, your contract might have language that precludes you from doing so. Intellectual property ownership. For example, like, I am currently employed by a place where there is a oh my goodness, intellectual property ownership clause in it, because they also do a lot with, like, tech. Now, praise God, I've learned how to turn my computer on. Like, for me, it wasn't a big deal. I'm not going to be designing any kind of, like, competitive, like, tech app anytime soon, that, is going to take business from my company. So that was not like a huge deal to me, but dependent on what your visions are for your life, that might be. So again, what's a non-negotiable for you? Is that one of them? Student loan repayment obligations. Some clauses might be in there. If maybe that's part of their way of having retention for employees, is to give you, $5,000 a year for student loan repayment. If you don't keep certain terms or stay there for a certain amount of time, maybe you might have to repay that, which again could be a lot of hidden cost. Professional growth, touched on this a little bit with prices already with CMEs. CMEs do add up. For paid CME days, it is pretty standard that this isn't a contract, that you maybe have anywhere from 2 to 5 days. Some are more, some are less, like in terms of places, what they actually offer for CME days. Some places just give you additional vacation time to compensate for that. So kind of actually just having a conversation and understanding, how the practice is laying out things in that way, I think is just an important conversation and consideration to have. Membership reimbursement. So if you wanted to be a part of, your state association, for example, is that reimbursable? Certification fees, and that's for all your licensure renewal that you need to maintain for your DEA license. Are these things included in um, your offer? I turned down job offers that I've had laid out for me because they didn't really support any of this. And I'm like, I am not a person that is going to be stagnant. That is, it's important for me to have professional growth. And then I've touched on already, like, making sure if you are in a state that allows you to have that full practice authority, yes, like, you're able to achieve it, but is there actually, like, restriction in your contract where your employer really doesn't support this? I think it's important to practice at your fullest scope of your license. I think that just even for the overall profession, you've worked so hard for your license. Like, why wouldn't you want that if you are capable of achieving it? But making sure that it's in alignment. Like, does your employer, when you meet these criteria, like, are they gonna give you a hard time about signing for it? That's important. Work-life balance, PTO approval process, having a good understanding of what that looks like at a company. You have to give 30 days before vacation. And then what does that approval process look like? I have been in a situation with an employer that really didn't have any process and would basically let you know like the week before, like, hey, yeah, this is approved. Hey, no, this is not. And that was actually very stressful. It's counterintuitive as to why you're taking a vacation. So I think working for a place that has good policies and procedures and really understanding that um, is important. Telehealth flexibility. Many practices do telehealth. Like, this is just the world that we're in now. Are is your employer, if you have 8 to 10 telehealth scheduled on a certain day, are they making you drive to the office to do a telehealth appointment? This is important to ask. Like, what is the expectation for that? Is there some flexibility? Because that's going to also impact your work life balance. Protected breaks. Do they believe in lunch? Uh, and I'm actually being serious. That is an important thing. Like, are you allowed to have certain blocks of time, maybe that you can chunk off for your administrative time, an actual lunch to take care of yourself, go to the bathroom. Um, I swear to you, I shared with you, I was an ICU nurse for years. In my primary care practice that I worked in, I swear to you, I was one of those people, like, I like did not go to the bathroom like until like the last patient was like gone for the day. Just it was just back to back to back to back to back. And then if God forbid, needed to take 5 minutes for yourself, you got behind just because of how stacked you were. So it's just important to make sure that those breaks are set with intention, and it's going to protect you from burnout and honestly like resentment, like where you're getting peed off during the day because you have to pee. Okay, very important. After hours charting policies. Um, is their time basically reasonable within the day for all the things that they're asking you to do from a workload, where it's where you have to take work home with you? So, an energy preservation audit. I really want you to think through these things, identifying like what drains you the most about practicing, what part of your current schedule feels unsustainable, do you feel resentful at work? This is kind of alluding to, like, are you getting breaks? Are you able to take care of yourself and your own needs so you can do a good job taking care of other people and their needs? What kind of energy preservers are in place? What schedule supports your nervous system? How much administrative time do you need at work? What boundaries protect your family time? Do you need, 4 days a week, 5 days a week, like to get your workload done? Do you need time set aside for telehealth if there's expectations with that? Do you have to drive into the office for that? Uh, for certain types of patients, for a wellness visit, for example, or just other types of visits, are you able to block longer periods of time so you could actually service the patients appropriately? And then how does this translate into a contract? You have protected administrative time. Is there a max patient cap? Do they have after hours charting expectations? Is there a clear PTO process? Again, the flexibility with telehealth. So negotiation isn't that you're being a pain in the butt and that you're being difficult. It's really just designing your job for sustainability. Confidence in negotiation comes from clarity before the offer. So going to the table with like your written things that you've reflected about, like what do you need to serve you in your job that's going to make you sustain in that job and actually also do a good job for the patients. So I think that going to the table with your 3 non-negotiables is going to help you to pick a job that is very well aligned for you. Very important. This is my case study. So Sarah's a new FNP. She signs her first job offer. Yay. Her base salary is like $118,000 is what's being offered to her. Important to ask, is this good or bad for her state, her region, And remember, I put links for where to find that information for like the MGMA, and then it's called Merit in the Facebook link under the description for after this. But like, is this good or bad? I don't know, depending. It's a 4-day work week. She has claims made malpractice coverage. There's no clear mention of tail coverage in her contract, but she got a good old handshake that says that they're going to pay for that for her. She has a 90-day termination notice. She works there about a year and a half. She has burnout because the expectation for volume patients for her as a new FNP is 20 to 30 a day. She's very overwhelmed, so she decides to resign. She has to stay there, and for her termination notice. So 3 months after leaving, practice informs her that she is responsible for $14,500 in tail coverage, and she is broke. She has no savings aside for this. Questions to ask, like, what did she overlook in the contract? What questions should she have asked? How could she have negotiated this differently? And just kind of like, what would you do if you were in that position? Again, I'm not a lawyer. I recommend to get a contract lawyer when going through your first, any contract with an attorney. I do have an awesome free NP contract checklist. If you would love to subscribe to my channel, and then you can email me for your free copy. And thank you so much for the opportunity, for letting me to help to teach you today. And hopefully you got a couple pearls of wisdom that'll advance your professional growth in nursing practice. And this is my email here.